Good morning. I'm calling from the PACU. This is Deshawn Vines, RN. I'm calling about patient Marilyn Hughes. Yes. May I have your name? Nurse Ratchet? Okay. Thank you. Again, my name is Deshawn Vines. I'm the RN on the PACU nurse on the PACU unit. I'm calling about patient Marilyn Hughes, born August 5th, 1976. The patient's status, ECG, sinus rhythm, heart rate 90, pulse present, blood pressure 142/86, respirations 19, her O2 is 98%, temperature is 99 Fahrenheit. I assessed the patient's IV. The site had no redness, swelling, infiltration, bleeding, or drainage. The dressing was dry and intact. The patient's initial diagnosis was with a left leg fracture, post-op PACU ORIF. At 2:10, the patient complained of severe pain in the left leg, surgical site brought on by touch or movement. When the patient was asked to rate her pain 0 to 10, she rated her pain at a 6. I assessed the patient's dressing. It was dry and intact. I examined the patient's legs at that time. I checked all pulses in all extremities. The pulse is strong on the right, 95 per minute and regular. The pulse is absent on the left side. The lower left leg looked cyanotic. When asked, could the patient move her toes or feel her toes, she said, no, I cannot feel or wiggle my toes. There was a prolonged capillary refill in the toes on the left side. There was a normal skin turgor. Her skin was cool and she was very sweaty. I loosened the restrictive dressing, assessed the patient's pain level. Again, she stated her pain went down to a 4, but she still had pain in the left leg and could not move her toes or feel her toes. At this time, I called the doctor and he came to assess the patient to rule out compartment syndrome. Marilyn Hughes is 45 years old, female, who suffered a left mid-shaft tibia fibula fracture when she slipped on icy stairs this morning. She was taken to surgery for an open reduction with internal fixation. She returned from surgery at 1:45 with a below-the-knee A-splint dressing. Her diet could have probably been advanced to regular dinner this evening. A family member has been with her at the bedside throughout the day. She began complaining of pain shortly after returning from surgery and was given morphine, 6 milligrams IV. She is now on every 30-minute post-operative vital signs. Her vital signs when last checked were 130/82, heart rate was 88, respirations are 16. Patient status, ECG sinus rhythm, heart rate 90, pulse is strong and present, blood pressure 142/86 at this time, respirations 19, conscious state appropriate, SpO2 98%, temp 99 Fahrenheit. Vital signs have been stable and neurovascular checks have been within normal range. She has an IV of lactated ringers infusing at 75 milliliters per hour. No infiltration noted, and she is tolerating liquids well without nausea. The patient denies nausea. No vomiting was observed by staff. No oxygen is present at this time on the patient. The patient's family should be informed of her prognosis if the patient has given consent for the information. This is my first recommendation. New PRN orders should be prescribed for the patient, both PO and out-of-bed orders for toileting and rehabilitation. Antibiotics prophylactically should be prescribed. The patient should be assessed immediately upon return from the OR after the fasciotomy surgery to relieve acute compartment syndrome. The patient should be placed on 30-minute neurochecks and vital signs. Pain management should evaluate the patient's pain if normal pain regimens such as morphine do not work or PCP. Frequent assessment of neurovascular function after fracture is essential. Sensory deficits such as paresthesia, burning, or tingling sensation. The patient should be evaluated for pain Q1 hour while awake. If the patient remains stable, she should be moved to the step-down unit as early as 4 hours from now. If you should have any questions or concerns, please don't hesitate to call me back at 3366. Okay, thank you.